Of CME Outfitters, I would like to thank you for joining us for this episode 1 in this 4-part CMEO Snacks series titled ADHD Can Be a Moving Target. Equip yourself with the tools to detect and manage ADHD to reduce its burden. Today's episode is titled Understanding the True Costs of ADHD, an examination of the whole life impact. This CME Outfitters Snack Series is supported by an educational grant from Takeda Pharmaceuticals USA Incorporated. I'm Dr. Ann Childress, President of the Center for Psychiatry and Behavioral Medicine, and also an Associate Professor of Child and Adolescent Psychiatry at Touro University, Nevada, College of Osteopathic Medicine, and a Clinical Associate Professor at the University of Nevada, Las Vegas School of Medicine in Las Vegas, Nevada. I'm joined today by my colleague, Dr. Thomas Brown, Director of the Brown Clinic for Attention and Related Disorders in Manhattan Beach, California. He's also a clinical professor of psychiatry and neuroscience at the University of California, Riverside School of Medicine, and a fellow of the American Psychological Association, as well as a fellow of the Society of Clinical Child and Adolescent Psychology. Welcome, Dr. Brown.
Thanks, Ann. I'm really happy to be here with you.
To frame the discussion today, let me review our learning objective. It is to identify the extensive burden imposed by ADHD by understanding brain morphology, cognitive and psychosocial functioning, and also psychiatric and medical comorbidities. Tom, traditionally ADHD was associated with unruly, poorly behaved kids who couldn't sit still. And fortunately, conventional wisdom has improved our understanding of ADHD. What do you see as the core problems in ADHD currently?
Well, first let me say, I'm not sure that everybody's gotten past that old definition of just being kids who couldn't sit still, wouldn't shut up, and driving everybody nuts. I think that there are some people who still think that way. But the way things have gone in our understanding, our scientific understanding of it, is we can now recognize that ADHD is essentially a problem in the unfolding of the brain's self-management system. And we use the term executive functions to talk about those particular cognitive functions, which are important. And it has different forms at different ages. And it's certainly true that there are some people with ADD who are hyperactive and antsy and impulsive a lot in a way that makes trouble for them. But there are also a lot of people who don't have any behavior problems associated with ADHD, but have instead a number of difficulties with some of the very component skills that are part of managing whatever one's doing, whether it's social interaction, family interaction, or a job.
So relative to our improved understanding of ADHD, let's take a look at the comorbidities and risks associated with ADHD in children and adults. ADHD is about more than being fidgety or a failure to pay attention. It is a neurodevelopmental disorder that presents with a constellation of symptoms that can affect the individual in a variety of domains, including psychological, cognitive, and functional. ADHD symptoms often persist into adulthood and vary in their impact. High rates of comorbidity contribute to the burden of ADHD. Nearly 2 out of 3 children with a current ADHD diagnosis have at least one other mental, emotional, or behavioral disorder. And ADHD severity has been positively correlated with mood severity. In children, ADHD may also co-occur with neurological conditions such as epilepsy and seizure disorders, and other conditions like atopic eczema, asthma, allergic conjunctivitis, allergic rhinitis, and type 2 diabetes. Comorbid conditions continue into adulthood. Adults with ADHD have roughly a 9 times higher rate of psychiatric disorders and twice the rate of metabolic disorders compared to the general population. Specifically,
ADHD in adults has been associated with increased odds of having a mood disorder, anxiety disorder, learning disorder, and or substance use disorder. Additionally, adults with ADHD may suffer from migraines, sleep disorders, asthma, and obesity. Psychiatric comorbidities in general play an important role in all-cause and cause-specific mortality risks in ADHD.
Tom, as we learned in the video, a wide variety of ADHD comorbidities can occur, and these include impaired executive functions. You developed a model of impaired executive functions in ADHD. Please elaborate on that.
Yeah, it's basically, I developed a model by listening to a lot of people who have ADHD, kids and adults, describing some of the difficulties that they experience with it. And these are you can see in the slide that's going to be shown that they look very neat little boxes with labels like activation, which has to do with being able to get organized and get started on things and not procrastinate excessively. With being able to focus, which doesn't mean just narrow in on one specific little thing, but it's more like focus on your driving, where you have to be, you're not just gluing your eyes to the bumper of the car in front of you, you're watching what they're doing, but you're also checking your side view mirrors, noticing a truck backing out of a driveway, paying attention to some pedestrians who are running across the street to catch a bus. And meanwhile, the stoplight's changing and you got to get your foot off the accelerator and move it over toward the brake. And while you're doing that, you have to get ready to make a turn, get yourself over to make a left turn. And while you're doing all that, you may be thinking about what you're going to buy when you get to the grocery store. And so what we're talking about here is something that's more like that focus on your driving, the ability to plan, organize, monitor what's going on, ignore some things, and pick up on some other things rather than just locking in on one thing. And the third section of it has to do with sustaining alertness and effort. For many people, managing sleep, getting to sleep when you want to and need to, staying asleep when you can, when you need to, and being able to get up and then stay alert during the day. Problems also with being able to sustain effort, to keep on going on things that are going to take a while and not give up too fast. And also the speed at which you can process information. For example, many people with ADHD will say, when I have to write an essay or even a long email, I have a lot of good ideas about what to say, but it takes me half of forever to get the sentences and paragraphs out on the page. So that's all aspects of being able to sustain effort and address whatever it is you need to be doing. Another piece of the model is one that it's not included actually in the official diagnostic criteria for ADD, but people with ADD repeatedly complain that they have trouble managing emotions. For some people, they're too quick to get angry. Other people, their feelings get hurt too easily. For other people, they get so consumed with, I've got to have this and have to have it now, even though it may not be such a good idea. And other people, they just worry an awful lot about what other people are thinking about them or about something that they're trying to do. And then in addition to that, there are two other parts of ADHD in the model. One is being able to utilize working memory. Many people with ADD have a pretty damn good memory for what happened a long time ago, some movie they saw years ago or some event that they were in, but often have a lot of difficulty in remembering things right in the here and now. It's the kind of thing where you walk in the other room and get something, you're standing there scratching your head or what the hell you came in here for. Or you're working on a project and you go downstairs to get something and you see something else that needs doing, and pretty soon you're involved in project number 2, having totally forgotten you're in the middle of project number 1 upstairs. Or kids will complain, they study for a test the night before the test. Somebody can ask them the questions and they get the answers very well, put together very well. And then the next day they go to take the test and they've just, can't remember some of the stuff they knew. So it's short-term working memory is a big problem for people with ADHD, even if they have very good long-term memory. And then finally, action It's, there's some people who even as adults are pretty hyperactive and antsy, and some just can't stop talking and monopolize conversations and stuff. But there are many people who don't have that kind of difficulty, but they do get impulsive sometimes. And they tend to just jump the gun and say things that 2 seconds after it's out of their mouth, they realize, oh, that was not a good thing to say to this particular group of people right now. So I guess my other point, though, would be that all of these different parts of executive function, which I'm describing, are not little independent things that function completely separately. They interact. If you think about what you do when you're driving a car, what you do when you're participating in a meeting or preparing a meal, each of these things plays an important role. And sometimes problems are more with one or two parts, and often it's right across the board.
So you discussed impairments in executive functioning, and they can be widespread in individuals with ADHD and impact both work and psychosocial functioning. Let's take a look at the brain regions that may mediate these impairments and other impairments seen in ADHD.
In addition to medical and psychiatric comorbidities, ADHD has been linked to structural and functional brain abnormalities. A variety of brain subregions, including the frontal cortex, parietal cortex, basal ganglia, cerebellum, hippocampus, and corpus callosum, are involved in the functional networks related to ADHD. These networks correspond to regions that support executive function, attention, reward response, and motivation. Changes in the connectivity or rate of perfusion in these regions impact the expression of ADHD symptoms. Decreased blood flow has been shown in the right orbital frontal and right medial gyri, as well as the bilateral putamen and cerebellum in ADHD. This decreased perfusion is a distinguishing feature of ADHD in children and adults without comorbidities compared to healthy individuals without ADHD. Normalizing perfusion in these regions may correspond to improving ADHD symptoms, to control attention, and motor response to irrelevant stimuli. In addition to perfusion, the degree of connectivity in these brain regions can impact the expression of ADHD symptoms. Impairments in the frontostriatal network may contribute to inattention and deficits in executive functioning in individuals with ADHD, whereas deficits in the frontolimbic system impact dysfunctions of reward response and motivation, subsequently causing hyperactivity. Moreover, changes in activation patterns in these regions, that is, underactivation or overactivation, have differentiated those with ADHD from those without. This indicates that perfusion, as well as connectivity in specific brain regions, can impact the expression of specific ADHD symptoms.
The fact is that most of what the brain has to do, particularly with executive functions, is centered in the prefrontal cortex, the main part of the brain behind the forehead. But it also is very dependent upon other parts of the brain that are processing information and emotions and so forth.
Great points, great points. Psychiatric comorbidities are common in individuals with ADHD. What are the main comorbid disorders seen in children and adolescents and adults with ADHD?
Actually, before I try to name off the different parts, I'd like to just emphasize why I think we see so much of people with ADHD having other problems with it. It could be a learning disorder, it could be anxiety, it could be depression, it could be substance use disorders, it could be OCD and so forth. But the way I think about it is, if you've on your computer, think about your computer. If you have a problem with, say, PowerPoint, it's going to screw up your ability to work with slides. Mm-hmm. But it's not necessarily going to interfere with your being able to use Microsoft Word or Excel. So the PowerPoint is a component unit of the computer. What's different with ADHD is it's not so much like problems with one little package of cognitive functions. It's more like a problem with the operating system of the computer. And so as a result of that, many people with ADD also have other problems that have separate names, but that often are linked to these underlying problems with executive function. And so I think what happens is that often people will be picked up by clinicians as having a problem with being depressed, mm-hmm. or a problem with specific learning disorder in reading or something. And often they don't look beyond that to understand that undergirding that are problems with these cognitive functions, the executive functions, that have a big impact on how other things can be done. So it's important, yes, to look at comorbidities, but also to look at the underlying problems with executive function, and not just stop there, but to think about, well, there may be some other areas where the person's having a lot of specific troubles, in addition to the more general problems with their executive functions.
And I see that quite a bit with patients coming to see me and they've been diagnosed with depression, mm-hmm. and maybe they've been treated with an antidepressant and they're really not getting better. And when we go through and look at things, wow, there's ADHD underlying Absolutely. It and driving it, right? It's driving everything. They're depressed because they're overwhelmed and they're not doing well at work, mm-hmm. or they're having trouble in their relationships.
Yeah, exactly right.
ADHD, as Tim Willens says, is not just a cosmetic disorder. And I love it when he says it because it's so true. Sometimes people trivialize it, but there are risks of premature mortality. And what are those risks that are due to comorbidities in adults with ADHD?
Often they have to do with impulsivity. That people with ADHD may not be hyper, but they may be very quick to jump into doing things and sometimes not think about the risk factors. And one of the areas where you see that is in driving. And so these cognitive functions that we're talking about as executive functions play a critical role in not only being able to drive a car and prepare a meal and carry on a conversation and understand what you're reading. And the problem is that sometimes those things also interfere with things that make a big difference in your health. Forgetting to take the medicine that one needs to be able to deal with some underlying health problem. With not keeping in mind some safety procedures that you need to do. When you're engaged in just walking along the street or driving on the freeway. That the ways that people, it is true that people with ADD tend to have more accidents and more illnesses. And sometimes it's the direct effect of the ADHD, and sometimes it's a less direct effect because they're not being careful enough in some things that are really important. And of course, there's another component to all this, and that is the frustration and discouragement that a lot of people with ADD experience daily. For example, problems with working memory, where they find themselves, they may have excellent memory for things that happened a long time ago or for the movie they saw 5 years ago, but they may not be able to keep in mind some critical information that's important for things they have to be doing right now, particularly in interacting with other people or on a job.
These problems in executive functioning and hyperactivity and inattention and impulsivity, they have a lot of other consequences too. Can you talk about some of those?
Yeah, I think that one of the important things is that what I alluded to a couple of minutes ago in terms of health issues. And that a lot of people think of it as like a school problem, because typically the model for a lot of people for thinking about ADHD is it's a school problem, that it may make it more difficult for you to study, to be able to remember what you've read, where you've got to go back and read the same paragraph 2 or 3 times before you can get it to stick, and which of course slows you down enormously. Or the kind of problems that some people get into when they're having to write essays, and they spend too much time on getting each sentence trying to get it just so, and you don't get the thing done in time to be able to meet the deadline. But there also are other things like not taking the medicine that one is supposed to need, that one needs and is supposed to take in order to prevent chronic problems with your health. There are a lot of different ways in which a person with ADHD let me say one more thing I want to say. ADHD has nothing to do with how smart you are. There's some people who have this who are like super smart, others high average, middle average, low average, and slow. I treat university professors and doctors and lawyers and big shots in business, a lot of people who are very successful and are looked up to by many people, but who struggle not because they don't have the smarts, but because that short-term memory doesn't hold for them in critical situations, or that they tend to be a little too quick to jump into things, to say things or to do things which put them at risk or mess up other things they need to do.
And I'm thinking about those risky behaviors and those health risk behaviors you talk about with substance abuse and just risky behaviors. For example, I saw somebody yesterday who was driving and he got a speeding ticket and he was driving 100 miles an hour. And he said, I didn't realize I was going that fast.
Yeah. It's a scary example, but he's not alone. And you're mentioning the substance abuse, I think, is an important thing. And that is, if you show me a 10-year-old kid who's been carefully diagnosed with ADHD, I can tell you that statistically, we can predict that that kid with ADHD has double the risk of having a problem with drug or alcohol use that could rise to the level of a diagnosis of substance use disorder if they are not treated with medication. And that stands beside the fact that many parents are reluctant to see their kids take medication for ADHD because they're afraid it'll cause them to get addicted to taking pills, when in fact, it's just the other way around, that somebody who really has ADHD has twice the risk of having a drug or alcohol problem compared to others of the same age if they don't have ADHD. And the medicines that the people who do have ADHD who get hooked on stuff, it's usually not with the ADD medicines. It's the same kind of thing that you see in the general population, getting hooked on too much drinking or too much drug use. And
often what I see is people forget to take their medicine for ADHD, right? Or they don't like to take it because they're having side effects. And I do a lot of clinical trials. So I'm looking for those patients that just have ADHD, right? And we have all of these comorbidities, or I'll have a 13-year-old who says, I don't want to take the P test. And I always think, oh, I'm glad I'm not going home in the car with them, right?
Yeah, right. Yeah, the other thing that I think is important to look at here is that we've got, when you've got a kid who's having trouble in school, often it's a matter of having forgotten the assignment, or what Russ Barkley talks about as time blindness. That many people with ADHD, just sort of have a hard time understanding, how long is this going to take me? Or when is that test again? Oh my God, it's tomorrow morning. Or the papers are going to be collected for that big essay, tomorrow, and I haven't even started writing it yet. So it's there are very practical things that tie into this, which adversely affect how people do in school and how they do in driving their cars. Not looking at the speedometer when he's riding 100 miles an hour. Is an example of a failure to take precautions that one really needs to, and it's not just precautions so you don't get arrested. It's precautions so you don't have a collision.
Right.
Lose control of the car.
Just yesterday, I had someone who was scheduled for a 4-hour screening visit. So half my day, and her mother had left a message on my voicemail Sunday night saying, so-and-so just remembered she has finals tomorrow and she can't come in, right? Because she has to take her finals. And she just told me about them because she just remembered now that she's
Yeah.
got finals tomorrow.
It's that working memory you depend on to keep in mind how what you're planning to do fits with what you have to do. And any of it, and let me say one other thing about this. All the things that we can talk about and do talk about as symptoms of ADD are problems everybody has sometimes. It is not like pregnancy where either you are pregnant or you're not pregnant and there's nothing in between. It's more like depression where everybody gets bummed out once in a while, but just because somebody's unhappy for a couple of days does not mean we're going to diagnose them as clinically depressed. It's only when the depressive symptoms are persistent and making a lot of trouble for somebody we say, yeah, that's a depression, we should do something about it. And in the same way, all of us have difficulty with every one of the symptoms we talk about as ADD sometimes. The people that we're diagnosing, who are reasonably diagnosed, are people that have a lot more trouble with it than most other people of the same age circumstances.
We've talked a lot about ADHD symptoms and other disorders. They have a real impact on quality of life. Can you talk a little bit more about that?
It has impact, for example, on the statistical stuff that's been done shows us that somebody who has untreated or inadequately treated ADHD is less likely to graduate from high school, and certainly less likely to complete a college degree, have more difficulty in being able to get and keep a job than most other people where everything else is the same except they don't have the ADHD. These are things that impact daily life things. And we've already mentioned the health issues, but the way you earn a living, the kind of relationships you have with other people, being too impulsive in reacting to people or forgetting to follow up on things. People begin to get frustrated and don't want to have to deal with you if you get too much of that too often with the same people. And they certainly has an impact on family life. And and you can understand why, the person who has the untreated ADHD, or I would say inadequately treated ADHD, is likely to run into difficulties with their job, as with their schooling, as with their driving.
Thank you for your overview. That was amazing. Tell me a little bit about the economic impact of ADHD in children and adolescents.
The short answer is that the implications of ADD untreated or inadequately treated cost money. And it costs money in terms of difficulties in being able to earn a living. It costs money in terms of needed to get additional medical care. And it's not, if you look at it in the macro view of sort of how much money is spent on taking care of people who've had motor vehicle accidents because they weren't able to pay attention while they were on the road, or who have to have more intensive medical care because they have not been taking the medications that have been prescribed for them to prevent some illness, which has been particularly problematic. It gets expensive that way too. But I think for most of us, the expenses you worry about are not so much what it's doing to the budget of the town or the country, but what it's doing in terms of the burden on members of the family and on the person himself or herself who has the ADD, who's not adequately treated for it.
And if we look at costs, if we are looking at what happens with the town or the country, we're talking about billions of dollars, not just a little bit. We're talking about billions.
That's true.
Tell us a little bit about some of your treatment approaches for ADHD.
The most important thing I have to offer for treatment is education. and that involves doing a careful evaluation to try to understand what may be ADHD. Incidentally, you'll hear me repeatedly using ADD and ADHD interchangeably. But what to look at, does this person have ADHD, and if so, how is it impacting them? But I also am interested in trying to understand the way, what the impairments are that may be associated with it. But eventually, then we move from, trying to help them understand, okay, what is this? Because so often the people who come into our clinics are people who have learned to think, particularly the bright people, are often taught to see themselves as just lazy, mm-hmm. that they have not been keeping up with their work, or their record for coursework in high school or in college is pathetic, or sometimes they're flunking out of schools in spite of the fact that they've got extraordinarily strong abilities. And those difficulties in schooling and also in work once they're employed often are costing them because of untreated ADHD. Now, there's certainly other factors that are involved in all of these things too. It's not like everybody's misfortune is traceable back only to ADHD, but the impact on what you actually accomplish in your dealings with other people, what you're doing in terms of job and education and self-care, all those things are impacted by ADHD. And for some people, it impacts it just a little. But for some people, it impacts in many ways that are really very problematic over a long period of time.
Education is a big piece. Medications are also a big piece. Would you talk a little bit about their impact on brain physiology?
Yeah. Well, the main thing to keep in mind is that medicines for ADHD have been very carefully researched. There's more research on the medicines that have been FDA approved for treatment of ADHD over the years than any other medicine anybody's ever going to take. And it's precisely because we use those medicines a lot with kids. Now the other thing though that has to be said is that it's not just the person needs a medicine, they need to have that medicine prescribed carefully in a way that's tailored to the particular body chemistry of each person. And unfortunately, many physicians and other prescribers get very little education about how to fine-tune stimulant medications. They don't get a lot of education about ADHD, period, but they get not much help in recognizing that, how much of the dosing of medicine for ADHD needs to be adjusted on the basis of how big are you, or how old are you, or how severe are your symptoms. It's a matter of how sensitive is your body chemistry to it. And so, I see in my clinic, and I assume you see in yours, that there are a number of people who say, yes, I've tried almost every medicine for ADHD. And then you start asking the doses, how much were you taking? And sometimes the problem is that you've had a prescriber who looked at the person who's a pretty good size for their age and has started them out on a dose which is way too high for them. When in fact, I find in our clinic, most of the little kids are taking very small doses. But there are a few of the kids, I'm talking like first and second graders, where we've got to go almost to the adult dosing range to touch them because their bodies are not that sensitive to those medicines. While on the other side, there are people who are like 6'2" and carrying 280 pounds who sometimes function on a dose that's not that different from what we'd be giving most of the 7 or 8-year-olds. And I think that it's really important for prescribers to be aware of the need to fine-tune the medicines in terms of how long they last. Some of the long-acting medicines last way longer than the advertising says they will, and some of them blow out and are useless after half of the time that they're advertised to last. So the fine-tuning of the medications and meeting of the prescriber with the patient and family to monitor how's it working and what side effects are there, because often those side effects can be dealt with if you have the information and if you encourage people to let you know about it. And so I think to get the right amount in the first place for this person, it often takes a while. So the medicines they don't they cure nothing. It's not like any of the medicines we have cure ADHD in the way that antibiotics can cure an infection usually. But they can often alleviate the symptoms. I think it's also important to be knowing that there's some behavioral stuff that needs to be done. For example, if you've got somebody who's got a lot of social anxiety, you're not going to cure that just by talking with them or just by giving them medicine. You want to work with them to try to venture their way into some interactions that they may be otherwise very nervous about. And you have to do the same thing in taking a look at study habits and stuff like that. But the other thing that I think is also important in that is it's important for clinicians to be able to talk with the patients and hear them and give opportunity. Some people don't need much psychotherapy. Other people need quite a bit of time to talk and understand because they've been living so long with feeling like they're stupid or like they're just lazy. Mm-hmm. And those are things that can be helped if there's somebody available to talk with and who understands what ADHD is about and who can see the potential of the person underneath what they may be showing in their difficulties.
Great points. And I know we've got a couple of slides that are going to talk about some of the educational outcomes. And I think about the little guys who are treated well and they come running into my office, Dr. Ann, look at my report card.
Yeah.
Right. So I'm hoping folks will take a good look at those slides. We could talk for a week about this and have such a good time. And I always learn so much when I talk with you. It's been a great discussion. And I hope we've provided our audience with some insight into the whole life impact of ADHD and how treatment really can improve outcomes. I'm going to summarize our SMART goals. Remember, specific, measurable, attainable, relevant, and timely. And we hope that our audience will take from the presentation these pearls and apply them to practice. We want for folks to understand the whole life impact of ADHD and really appreciate those benefits with different treatment modalities and alleviating disease burden. To appreciate the impact that medication adherence has on ADHD symptoms and comorbidities, and recognize that the comorbidity profiles of ADHD may differ in children and adults. This CMEO snack is one of a 4-part series, and we hope that you'll take advantage of all the short and focused activities in these series. Dr. Brown, thank you again so much for joining me today.
Thanks, Dan. It's been a pleasure.
And thank you to our audience for joining us. Be safe and take care of yourselves so you can take care of your patients.